We should just touch on it for a second because you will have heard that the NDP's Pharmacare plan does not stop for people under 25 or start for people over 65. They're talking universality. Now, because we work on this, we know a little bit about it. There's actually 20,000 prescription medications that are acceptable approved in the world today. The Ontario government maintains a formulary, so a list of drugs that Ontario will pay for. That has about 4,400 drugs on it. So that is what's covered under the OHIP Plus plan for younger people and for the over 65s. The NDP is talking about 125 of the most commonly prescribed drugs.
Right.
So the Liberals and NDP have gotten into a little bit of who's really universal here. Right. Maybe you could just take a second to talk about what Andrea Horwath articulated this week as well, because she's been out there for about a year on Pharmacare, but this week introduced something new.
Right. I mean, if you think about Pharmacare in terms of a spectrum, those on the more progressive or left-wing point of view, at one extreme, it's fully universal, all drugs, and no copay is completely free. Kind of like the way Medicare is right now, where you just go to your doctor's office and you get seen, you don't have to pay anything out of pocket. But if you move along that spectrum a bit, there is this notion of ensuring that you only cover the costs of the drugs that are the most cost effective or a certain amount of drugs. So in Ontario, it's the case of there are 20,000 drugs, as you mentioned, that are approved. Private insurance covers about 15,000 of them, and then the Ontario government, though, only covers 4,400. And then, so I think that what the Liberals are trying to do is they're trying to say that, look, it's not fully universal because we're only making it available to those under 25 and over 65, but we are making it fully free. The NDP, on the other hand, they are okay with the idea of the deductible. Their plan includes continuing the $2 deductible and the $6.11 deductible, copay and the deductibles. However, they are making it universal to all those who need it. But again, reducing that list of medications even further to reduce the overall cost to the ones that, primarily for those chronic diseases, the ones that people genuinely need, and cost issues can really cause significant affordability problems.
All right, and we also heard Andrea Horwath this week introduce the notion of dental care.
Right.
Why don't you take a minute and tell our viewers what she was talking about there?
Right. I mean, it'll lead up to the throne speech. Andrea Horwath and the NDP made a big splash with respect to a new dental care benefit, the timing is interesting. Not only is it before the throne speech, but after the PC leadership, where the PC leadership convention and the race itself was sucking up a lot of the oxygen, the political oxygen. So they felt that, I believe, that they had an opportunity to make a big splash, and they did with respect to a new dental care program that's universal. It's available to all. However, those who have private insurance would retain that coverage, and those employers that do not provide dental coverage to their employees, and there's a minimum amount of coverage that they would need to provide, they would pay for a certain amount. So essentially what this means is that all Ontarians, regardless of your income, would have access to some degree of dental care, but there would be it would be a premium-based system whereby employers paid 75% of the cost and employees paid 25% of the cost, which comes out to about, according to their plans, about $4.55 a week.
That the employee would pay?
That the employee would pay. But that would be refunded to those lower income employees under $30,000 and on a sliding scale between $30,000 and $50,000 of income. So ultimately the idea being that to make that coverage available, the total cost would be $1.2 billion, which is a significant amount. But but the NDP, I think what they're trying to do is they're trying to convey that they can be the party that's trusted most in healthcare, and they are the party that will expand Medicare to not only include healthcare but also dental care.
Right. So again, the NDP is looking to get those left of center voters, those progressive so-called voters, that have a belief that government should play an ever-increasing role in the lives of people. And again, as we've talked about, when the polling indicates, and all the political parties are polling like crazy these days, that affordability and the cost of living matter to people, and the status of our healthcare system matters to people. On the affordability and cost of living, I mean, the Ontario government can't do anything about the price of bananas, or really very much in terms of things we buy, but they can intervene on things like prescriptions, and they can certainly make it more accessible, easier to get to, cut the wait times, et cetera. Because I think the research indicates that generally speaking, people in this province are content with the quality of the healthcare. They hate waiting for it, they don't like to pay for it, and they want it accessible all the time.
Yeah, and from a political perspective, they say that you can lose an election on healthcare, but you can't necessarily win an election on healthcare. So given where we are in the electoral cycle, where the election is about 2 months away, what the Liberals wanted to do this week was really to firmly plant themselves on the healthcare file to ensure that